Good afternoon, everyone, and welcome to DIBEL's June Wednesday webinar. I think we're going to have the slides popping up on the screen here in just a moment for everyone. Our presentation today is Teen Parenthood Matters. Let's talk about prevention. So like I said, I am Rachel Savasik-Luxton. I'm the Director of Research and Training here with the DIBEL Institute, and I am thrilled to have you on today's session. We're also honored and thrilled to have Dr. Kristin Anderson-Moore, a senior scholar with Child Trends, and Alison McClay, a senior research analyst also with Child Trends. I'll introduce them in just a moment, but before we do, we have some technical things to address before we get started. So the first thing is, if you cannot hear this presentation, please exit the webinar and opt to call in on your phone, as this tends to solve most audio problems. We also want everyone to take a moment to locate the hand on yours. So it's a little hand icon on the GoToWebinar control panel. And we just want to know, for anybody who is new to DIBEL webinars, if you can click that, we just kind of want to see who is in the space here with us this afternoon. That would be lovely. So I see a couple of hands kind of going up. Welcome to your first Wednesday webinar with the DIBEL Institute. The handouts for today's presentation, you can find those located in the handouts section of the control panel. I also want everyone to take a moment to please locate the question box located in the control panel, as that's what we'll be using to monitor questions. We do encourage you to go ahead and submit the questions as we go throughout the presentation, and our presenters will have about 10 to 15 minutes at the end where they will address that. So before we get started into the presentation, I just want to give you a little overview about the DIBEL Institute. On this slide, you're going to see a picture of Charlie and Helen DIBEL. They are the founders of the DIBEL Institute. And Charlie did a lot of work with young people during his retirement and saw a lot of difficulties they were having around their relationships, or how when parents were having difficulties, the impact that it had on their children. So he had the brilliant idea to translate research into teaching tools that could be made widely available to young people. So while the DIBEL Institute is now a direct service provider, we do develop research-based practices and make them available to individuals like everyone here on today's session. So I'll tell you a little bit more about the DIBEL Institute. We are a national independent nonprofit organization. We have clients in all 50 states who are providing direct services. And last year, based on our conservative efforts, clients reached over 119,000 youth based on the materials they purchased. So we're grateful to all of you who are here and maybe not here live, but attending later and watching the recording, doing this important work with young people, so thank you. A little bit more about us is our mission is to help young people successfully navigate their intimate relationships through important information to help build their knowledge around relationship building and also skills-based practices. We know that having conversations with young people, in these conversations in particular, pulls a lot of levers. So pregnancy prevention, DV prevention, mental health levers, job readiness, and even more. And we have a couple of core values that guide our research. The first one being that we are our work. The first one being that we are big believers in research. So you can see I have it on my mind. All of our programs are research-based. We continue to strive for evaluations on our programs to demonstrate their impact and effectiveness. And that also means that updates are made to our programs as we learn new information. Our next core value is that we believe in stable, safe, and nurturing families. And these are families of all different formations. And our goal is for young people to, to experience this and be raised in more families like this. We also believe that relationship education is for everyone. All of us can improve our relationships, and we really make sure that our programs are reflective of that and that youth feel included and represented in our programs. So with that, that's a little bit about the DIBEL Institute, but y'all are here to, to hear from our presenters from Child Trends. So Dr. Kristin Anderson-Moore, Chris, is a past president and senior scholar at Child Trends. Dr. Moore has published more than 150 journal articles and books, as well as numerous research briefs and blogs, and brings more than 40 years of experience in designing, implementing, and conducting research evaluations on families and children. And we also have Alison McClay, who is a senior research analyst with Child Trends, Youth Development, and Sexual Reproductive Health focus areas in research. She uses mixed methods research to examine the impact of program interventions on youth and young adult outcomes, and is passionate about her applied inter and multidisciplinary research that supports and promotes optimal adolescent development. So with that, I'm going to go ahead and turn it over to our presenters.
Thank you, Rachel. I'm Chris Moore. Thank you all for joining this webinar. I'm a social psychologist in the youth development group at Child Trends, and I've spent much of my career focusing on teenage childbearing, and I'm delighted to share that experience with you today.
And I'm Alison McClay, a newly promoted research scientist in Child Trends, Youth Development, and Sexual and Reproductive Health research areas. But prior to joining Child Trends and the research and technical assistance realm that I now operate, I work directly with youth and young adults as a math teacher, an out-of-school time practitioner, and a community health educator.
Well, our goal today is to tell a story. It's the kind of story that a researcher would tell, but it is a story that crosses several decades. And I hope that it is interesting and possibly useful for you. It starts with an overview of the trends in teenage childbearing in the United States and in other developed countries. Then we describe the Social Genome Model briefly before sharing a simulation on the effects of teen parenting on teens. Then I'll share a very short history of prevention research on teen pregnancy based on my experience over the decades, which evolved into the positive youth development approach and El Camino, a positive youth development program to prevent teen pregnancy. Our hope for this webinar is that participants will be able to discuss the implications of teen childbearing, appreciate the positive youth development approach to avoiding teen parenthood, and understand the El Camino positive youth development curriculum that helps youth identify goals that lead them to delay sex and pregnancy. We're going to start with the trends. There has been a substantial decline in teen birth rates since 1990, reflecting changes in both sexual activity and contraceptive use, as well as programming. The top line shown here is for teens 18 to 19, and it shows the steepest decline. The bottom line, which is in pink, is for teens 15 to 17, but you'll see it has also declined dramatically. It's lower, but it's also declined. The overall decline is shown in the middle line in blue for teens 15 to 19. And that decline goes from 61.8 to 14.4 in 31 years. In other words, the teen birth rate is now a quarter of what it was 30 years ago. However, the teen birth rate varies a lot across states, as you can see here, with the states in shades of red having considerably higher teen birth rates. Give you a moment to find your state and study it. Next slide. The US overall has a higher teen birth rate than other developed countries. In addition, the teen birth rate is higher in most states than it is in other developed countries. The next highest rates are New Zealand and the United Kingdom, shown here at 13 and 11, compared to 16 at the time this was developed for the United States. While the lowest rates are for South Korea and Denmark at just 2 births per 1,000. And you'll see also that Japan and Netherlands and Singapore all have birth rates of 3 per 1,000. So a lot of countries have much lower teen birth rates. Okay, the teen birth rate remains fairly high, and nearly 150,000 births occurred to teens in 2021. So we conducted analyses on the implications of teen births using a recently updated version of the Social Genome Model, a collaboration among Child Trends, the Urban Institute, and the Brookings Institution. So what is the Social Genome Model? It is a projection model from the prenatal period to age 30. It's structured around key life stages and benchmarks of success for each of those stages. The estimates are done separately by race, ethnicity, and by sex, and it is built from publicly available data. So the model is built to incorporate theories of child and youth development. So it's a life course model you can see in this stepladder design, in that it goes from birth to age 30, and we do projections to retirement age. It is also an ecological model depicted in the green box on the left, in that it assesses the child's characteristics, the family, the school, childcare, and neighborhood. And it covers each developmental domain, shown in the upper right green box, in that it covers academic, social, emotional, health, and relationship developmental outcomes for children, using different and age-appropriate measures for each age. It's designed so that if you make a change in, say, preschool, the effects ripple through elementary school and high school into adulthood. As you can imagine, it took years to develop. So you can use the social genome model to do two types of simulations. The first is a scaling simulation, where you expand results from evaluations, like an evaluation of an after-school program or a job training program. In these simulations, we use effects from real-life evaluations of programs and policies. We plug them into the social genome model and see how later life outcomes are affected. An aspirational simulation is where we use effects that are not based on evaluation findings, but that are truly aspirational. We plug those effects into the social genome model and see how later life outcomes are affected. We want to note that the social genome model is not a causal model. It's not an experimental study, and it cannot be used to draw causal conclusions, but it enjoys a number of benefits. Users can estimate the additive effects of multiple program interventions. For example, if you took the effect of an early childhood program plus an elementary program and saw what their additive effect is. Users can also compare the effects of different interventions on an outcome. The social genome model, as I noted, can project varied outcomes to age 30 and lifetime earnings to age 65. And the model can show how the effects vary by race, ethnicity, and sex, and how the simulations affect disparities across these groups. So at this point, I'll turn over to Alison to describe results from the study that we did using the social genome model.
Thanks, Chris. So now that you have some understanding of how the social genome model works, we want to highlight findings from an aspirational simulation we ran last year. Driving our simulation was a question of how might later life outcomes change if teens did not have a child during adolescence. We ran an aspirational simulation to ask, what if we prevented all births to teens before age 20? As Chris shared, these aspirational or what if simulations are from when we don't know of a specific program or evaluation that can or has done what we're running in the model. This simulation is aspirational because we don't know of any intervention that could prevent every single teen birth. We also don't even think that's possible. But this exercise that we did gives us some sense of what could happen if we were able to prevent teen births. So within the social genome model, approximately 17% of the model population had the propensity to have a child by age 19. You're probably wondering why I said propensity to have a child. Without getting too much into the weeds of the model's methods, we use this language because it's the way we estimate whether someone is likely to have a child within the model. So in order to run our simulation and project how later life outcomes might change if teens did not have a child during adolescence, we reduced that propensity of having a child for, again, that 17% of the social genome model respondents who were likely to have a child by age 19 down to 0. And after running the simulation, we then observed how this change might affect health, education, and earnings outcomes at all the subsequent social genome model life stages. As Chris shared, these are at age 24 and 30, as well as the lifetime earnings at age 65. With our simulation, we make the change in adolescence at age 19. The first time we could see a potential effects of that change in outcomes is at age 24. On this slide, we're showing the percent difference in mental health rating that we estimate would be a result of not having a child in adolescence. For example, we estimated that the mental health ratings of Black women who had a child in adolescence would increase by 12% in a positive direction if they instead did not have a child in adolescence. And as we can see from the figure, we observe notable improvements to the mental health of women overall in early adulthood when teen births are prevented. As I continue to review results, it's important to note that the white and other race group includes a small percentage of people who identify as Native American, Asian, or Pacific Islander, or more than one race. Because of sample size constraints, the social genome model cannot estimate simulations separately for this group. And like the improvements we see here on this slide for mental health, preventing teenage births within the simulation also resulted in improvements in physical health in early adulthood. Another key early adulthood outcome that improved when teen births were prevented is high school diploma attainment. In this figure, the solid navy bars represent the outcomes for the social genome model population that had that propensity to have a teen birth, that is the underlying data in the model. We observe what happens when we prevented teen births in the simulation, our intervention, with the stripe bars for each population group. Looking at the first group listed in the figure, about 57% of Black women within the social genome model sample who had the propensity to have a teen birth had a high school diploma. But when we prevented the teen births in the simulation, we saw that the high school diploma attainment increased by 7.4 percentage points up to 64% for Black women in the sample. On average, when teen births were prevented in the model, we saw increases in high school diploma attainment by 10 percentage points, with increases ranging from 6 percentage points for white and other race men to 18 percentage points for Black men. I'd anticipate a question about why these, oh, sorry. Next slide, please. Moving to our next life stage, we were curious about how preventing teen births could lead to improvements in bachelor's degree attainment and earnings at age 30, like high school diploma attainment at age 24. We observed notable increases in the attainment of bachelor's degrees by age 30. By age 30, we see that bachelor's degree attainment increased by about 5 percentage points for men and 7 percentage points for women. Again, the solid bar represents that outcome for social genome model population that had a child by adolescence, and the striped line shows what our outcome would have been if that teen birth was prevented for those same individuals in our sample. Additionally, our simulation for age 30 indicates that annual earnings increase when teen births are prevented, with women overall having a substantially larger income increase than men. Our last outcome that can be projected in the social genome model is lifetime earnings. Lifetime earnings are the total amount that someone is projected to have earned by age 65 within the model. We found that lifetime earnings also increase when teen births are prevented. The patterns we observe here are similar to the ones we just saw at age 30 for earnings, with Hispanic women seeing the greatest increase in both dollar earnings and percent increase in simulated lifetime earnings. So what does this mean? What can we take from this? Our simulation using the social genome model indicates that preventing teen births is associated with important differences in life outcomes for everyone, but especially for young women. When teen births are prevented in the simulation, young women are more likely to earn high school and bachelor's degrees, have higher earnings, have incomes that move them further away from poverty, and enjoy better mental and physical health. Next slide. Nonetheless, these takeaways are not without limitations. We know there is heterogeneity in teen birth experiences. However, the model's measure for teen birth groups all adolescent experiences together. So we're unable to assess differences in outcomes that could have resulted if an adolescent was an older teen when they had their child, or if the pregnancy were intended. Nonetheless, we know that 75% of pregnancies among teens ages 15 to 19 are unintended. So it's likely that the majority of the social genome model sample who had a child, or that propensity to have a child by adolescents, resulted from an unintended pregnancy. Additionally, the social genome model in this simulation does not include measures of protective factors or supports from which adolescents in the sample might have benefited, such as a teen graduating high school before they had their child, or having family, friends, school, or workplaces that provide childcare. These sorts of protective factors could mitigate potential consequences of having a child during adolescence. And additionally, our simulation does not directly account for the structural impediments and social determinants of health, such as racial segregation, income inequality, and access to health care and health insurance that may contribute to higher teen birth rates. Honestly, this is an aspirational scenario. We haven't figured out how to prevent early childbearing. Teen birth rates have declined, but they persist. These findings indicate that it continues to be a worthy endeavor. And research has concluded that simply providing information on abstinence and contraceptive methods does not yield significant changes in youth sexual behaviors. Instead, evidence suggests that comprehensive sexuality education, taking a positive youth development approach to adolescent sexual and reproductive health, may be more effective. In addition, our simulation can't speak to every important nuance of this complex issue. We know there's not a one-size-fits-all approach in prevention or response, and what works for older teens might be different from what works for younger teens. And while we're working on prevention, we also can't forget about supporting young people who are already parents. For example, providing supports such as on-campus childcare to help young parents finish their education, and publicly funding family planning services to avoid repeat births. Other promising practices in the field include navigation services and tailored programs and resources that can support and meet the diverse needs of expectant and parenting teens, so that all teens and their children have the opportunity to thrive. I'll now turn it back over to Chris, who's going to talk further about some of our approaches to prevention.
Thanks, Alison. Okay, so if rates are high and the consequences of teenage childbearing are concerning, what are some approaches to prevention? Education, of course, as Alison said, is important, but many studies have found that education alone is not sufficient. As you saw in the early 90s, the teen birth rate was really quite high. A different approach was needed. So it was important for researchers to step back and spend some time thinking about what we should be doing. We, that is researchers, but also practitioners and policymakers, started at a place where much of the work to educate and support youth and young adults was very siloed. There were programs on teen pregnancy prevention and other ones on substance use, juvenile delinquency, or dropout, and then separate programs focused on unemployment. Now, obviously, some of these silos are necessary and they're still there, but we had started to realize just how much overlap there was. Go to the next slide. In other words, many of these young people who are stuck in different silos, like the child welfare system and the juvenile justice system, are the same people. And eventually researchers noticed that young people are not silos, but whole human beings, and that many risk and protective factors overlap across silos. A teenager may struggle with poverty, poor schools, racism, and crime in the neighborhood. Rather than addressing one problem at a time, it became clear that broader interventions are needed. So, enter positive youth development. Because positive youth development approaches think broadly about the whole person, because positive youth development focuses on young people as individuals, and because positive youth development works specifically toward positive outcomes, it represents somewhat of a breakthrough approach. Information, services, and education are definitely part of these programs, but these programs go beyond education and beyond scare tactics to be supportive, non-punitive, relationship-based, age-appropriate, and oriented specifically toward that young person as an individual. So they work to reduce risk factors while focusing on positive outcomes. And it has helped. I recall that the first report issued by the National Campaign to Prevent Teen Pregnancy was titled No Easy Answers. Several years later, as new programs came online, the second report was titled Emerging Answers. Importantly, positive youth development approaches are not a single curriculum, but an approach that can be used in many different communities, different program settings, and different age groups. We have used it in job training programs, juvenile justice, and foster care. And many, including child trends, have used positive youth development in programs to prevent teen childbearing. So, how is positive youth development defined? This definition comes from the website youth.gov. Show it, and I'm going to read it if you want to follow along. Positive youth development is an intentional, that's an important word, intentional pro-social approach that engages youth within their communities, schools, organizations, peer groups, and families in a manner that is productive and constructive. It recognizes, utilizes, and enhances youth strengths and promotes positive outcomes for young people by providing opportunities, fostering positive relationships, and furnishing the support needed to build on their leadership strengths. At Child Trends, we have been very fortunate to be funded by the JPB Foundation to create a program for high school students that is built on these positive youth development principles. It's called El Camino, and it focuses on Latino students, as the teen birth rate among Latinos has been relatively high, and there has been a dearth of culturally relevant programs for this growing population. El Camino seeks to foster student educational engagement and prevent teen pregnancy. The approach focuses on helping students identify their own personal life goals, and then to think through what they need to reach their goals, and then make informed educational, sexual, and reproductive choices that align with those goals. The El Camino curriculum was developed by a research team in consultation with curriculum developers and sexual and reproductive health experts, and it draws on classroom observations, student focus groups, surveys, and facilitator feedback. Child Trends incorporated youth voices and feedback throughout development of the El Camino curriculum to ensure that it is age appropriate and user-centered. Specifically, El Camino is a goal-setting sexual health promotion curriculum that is implemented in both English and Spanish. It is free and it's accessible on our website. So El Camino has 3 sections. The first section aims to encourage and empower youth to set positive life goals. That's how it starts. The second section helps students make informed sexual and reproductive health choices. And the third section guides students toward healthy relationships. We depict life as a road, a Camino, to stimulate students to think about their goals at age 25, shown in this figure. in the STAR. We find that for many kids, this is the first time they are asked to seriously think about their own goals for their life. Then, when they establish their goal, they can think about what they need to do to reach that goal. Today, in the next 3 months, in 12th grade, after high school graduation, and at age 20. Alison will pick up the story.
So central to the curriculum is its 4-step approach, STAR, that will guide youth throughout the curriculum. In Spanish, we have translated STAR to be para. With the roadmap or Camino shown on the last slide, we ask youth to come up with that goal for age 25. And through El Camino, youth learn how to use STAR to help them reach their goals. State your goal, think about the steps, assert your Camino, reach your goal. Throughout the curriculum, there's a wide variety of activities, which will pop up on the next slide. Great. Lectures and discussions are a necessary format, but El Camino includes a lot of active and engaging components. These activities build upon many positive youth development principles, including involving youth as active agents, developing youth skills and assets, and involving members of the community throughout programming. For example, when students vote with their feet, they get up and go and stand in a group with others who have a particular opinion that shares their own, and discussion proceeds from there. We also ask students to ask a parent, guardian, or other trusted adult what that person thinks the young person's goals should be, and then reflect on how the adult's opinions align or differ with the youth's own goals. Students also practice and demonstrate skills through role plays and skits. For example, in one role play on assertive communication, youth practice respectfully, clearly, and firmly saying what they're thinking, feeling, or wanting or not wanting. Practicing saying and showing with body language what they really mean and protecting their limits. There are also novellas throughout the 11 lessons, and we'll introduce you to 2 of the main characters that are featured in the novella before covering some positive and negative road trips that can affect young people's journeys, as well as ways of recognizing warning signs and how to use them to stay on your Camino. And then we'll use one of those novellas sections to illustrate what they're like and how they build off the curriculum's key message. So in the first lesson, on the next slide, great. Students are introduced to Sofia and Santiago, STAR, and the Camino roadmap. Students can practice goal setting using Sofia and Santiago's stories before coming up with their own goal at age 25 and thinking through the steps that will get them there, like Sofia's Camino shown here. Now to the story.
2 years ago, Sofia moved to the United States to live with her Aunt Camilla. Sofia is in 9th grade. Aunt Camilla's oldest daughter, Angela, is in 11th grade, so 2 years older than Sofia. Angela and Sofia like to go shopping on Saturdays. Sometimes Sofia and Angela stay up late at night talking. Sofia feels comfortable talking to Angela. Angela wants to be an engineer and hopes to go to a good college.
When Sofia first arrived at her aunt's house, Sofia met her cousin Santiago. Santiago has helped Sofia improve her English and introduced her to some of his friends. Santiago lives with his parents and 4 brothers and sisters. Santiago likes to listen to music and has been teaching himself how to play the guitar. Santiago works after school and on weekends at his parents' grocery store. He studies hard and gets good grades, but sometimes he misses school to help his parents at the store. Santiago would like to go to business school and open his own business. However, he worries that his parents will not be able to pay for him to go to college.
Sofia could have higher grades, but she doesn't really like to study. Sofia spends a lot of time playing video games and hanging out with her friends. Since her Aunt Camilla works 2 jobs, Sofia is often home alone. There is a boy named David in Sofia's science class who she would like to spend more time with after school. However, David usually hangs out with some older boys, and she rarely sees him outside of class. Sofia joined the high school soccer team and is a first-string player. Sofia would like to do something sports-related when she's older, perhaps a physical therapist working with athletes or a high school coach. Right now, she thinks she would prefer being a physical therapist.
Next slide, please. Central to the principles of positive youth development and existing guidance for integrating positive youth development practices within teen pregnancy prevention programming is providing youth opportunities for skill building. 2 skills covered in El Camino are being able to recognize road trips and warning signs. Road trips are life experiences that can either keep you on track to achieve your goals or create obstacles that may require you to rewrite the steps needed to achieve a goal or make it that you need more time, energy, or resources to get back on track and achieve your goals. And sometimes staying on your Camino can be difficult. However, to reach your goal, the R and STAR, you need to be prepared to stay on track. And if you go on road trips that may take you off track, you need resources to get back on your Camino. The curriculum encourages youth to identify the various resources youth have, their own intelligence, experience, judgment, knowledge, skills, and resilience, as well as family, friends, and community members that can help youth in achieving their goals and sticking to their Camino. And building upon this road trip foundation, we empower youth to learn to recognize warning signs that tell you when you might be taking a road trip that'll take you off track of your Camino. So warning signs, they're what tell us what something could be a bad outcome or something is risky or not right in a certain situation. When we experience warning signs, we can use our feelings, our brain, and our senses to make good decisions. And warning signs can help us to stay on our Camino and also tell us when something could get us into trouble, because it's important to think the T and STAR about what you're doing and the potential consequences of your actions. And as El Camino facilitators often tell youth, it's important to pay attention to warning signs and not ignore them. Our warning signs are almost always going to help us make decisions that are right for us, whether that's in relationship or other aspects of life. Being able to read warning signs will help us avoid going off track of our Caminos. And in the novella, where it picks up and where we're about to feature, we invite students to engage when they recognize warning signs.
Throughout the curriculum, we follow cousins Sophia and Santiago and their friends through key periods of their adolescent lives. Where we pick back up with the novella, Sophia and Santiago are heading to a party. Sophia's friend Alicia invited Sophia to a birthday party for Pedro. Pedro is in 12th grade. Alicia tells Sophia that Pedro's parents will be out of town the weekend of the party and that everybody will be there, including David. David, as you recall, is in Sophia's science class and she has wanted to spend more time with him. Sophia knows that her Aunt Camilla will not let her go to the party. Her aunt is always telling Sophia she must keep a close eye on her because her parents are out of the country. However, Sophia decides to go to the party and tells her aunt she is spending the night at Alicia's house.
Sophia mentions the party to Santiago. Santiago usually works on the weekends at his parents' store. He knows if he goes to the party, his parents will need to work extra hard at the store. Santiago decides to go to the party anyway, and he tells his parents that he's meeting a friend to work on a school project. At this point, we ask students, do Sophia and Santiago feel any warning signs?
Oh, when Alicia, Santiago, and Sophia and Santiago arrive at the party, the house is really crowded. They know that some of the people from school, but they also see some of Pedro's older friends. The music is loud and people are dancing. Santiago sees a friend and leaves Alicia, Alice, and Sophia. Alicia and Sophia. As Alicia goes into the kitchen to get drinks, Sophia sees David. Whoa, he is so hot. David smiles and waves at Sophia.
David comes over, puts his arm around Sophia and says, I was hoping I'd see you here. Sophia tells David that she really loves the music, and David suggests that they dance. David and Sophia dance for a while, and Alicia starts taking pictures of Sophia and David dancing and posting them on social media. Again, we ask students, Does Sophia feel any warning signs? When does she feel the warning signs, and how might she respond? And how can Sophia assert herself and protect her Camino? Next slide.
Well, as you might be hoping, in the following scenes of the novella, Sophia makes good use of her warning signs and road trip skills. The novellas have proven to be very engaging and thought-provoking for the students, such that the students worry about Sophia and whether she can follow her Camino. El Camino reflects a number of positive youth development principles, as shown here with Sophia's Camino. It is focused on the individual. The Camino showed here is specifically for Sophia. It has a positive focus, which is Sophia's goal of becoming a physical therapist, shown in the star. The steps along the way articulate what Sophia needs to do to reach her goal. Sophia is recognized as a whole person with a social life as well as an academic side. Resources to support Sophia are identified, that is, protective factors that can help Sophia along the way, such as parents, teachers, and other trusted adults. Well, the research question, of course, is whether students translate these messages into their own lives. And Alison has some preliminary data to share on this.
Thanks, Chris. We can go to the next slide. So preliminary research on El Camino's implementation suggests that youth responded well to the curriculum and that participation led to changes in their attitudes and knowledge. 3/4 of students rated El Camino as excellent or very good during the pilot. And the vast majority of students, 91%, reported that El Camino had made them either less likely to have sex, more likely to use a condom, or more likely to use contraception. Specifically, more than half of students said that the curriculum made them less likely to have sex. Close to two out of 3 students said it made them more likely to use contraceptions. And nearly 3 out of 4 students said it made them more likely to use condoms. So from pre-test to post-test within the pilot, students who participated in El Camino also reported significant changes in important attitudes and knowledge, including confidence about discussing sex and consent, contraceptive knowledge, and setting goals. Child Trends is currently conducting a multi-year evaluation of El Camino in Montgomery County, Maryland, in partnership with a local implementation organization called Identity and the University of Maryland, with funding from the U.S. Office of Population Affairs. And I'll turn it back to Chris to bring us home.
Well, to sum up the story, rates of teenage childbearing in the United States have declined substantially, but the rate has remained higher than the rates in other developed countries. Also, teen birth rates remain particularly high in some states and some communities. Given these relatively high rates, it is concerning that our simulation model indicates that early parenthood can have negative and lifelong implications for education, employment, income, and well-being. We noted that early prevention programs were often didactic and a few tried to scare teens. But gradually, a new approach that was youth-centered, supportive, and positive broke through the silos that focused narrowly on individual issues. This approach, positive youth development, has proven more engaging and meaningful for teens, and these programs have generally been more effective. There has been a gap for Latino youth, though, and Child Trends developed El Camino for this population. Though it seems to be engaging, we find, across populations, the curriculum is available for free for anyone who's interested. There's a link to a resource list to obtain the link that Rachel will share information about finding it. Also on the resources list, there's a list of relevant materials. And of course, please feel welcome to get on the Child Trends listserv to receive free updates on our research and evaluation work. Thank you for your interest. We look forward to questions and discussion.
Thank you for that wonderful and engaging. The Social Genome Project, I was like, I need to know more about this, but I'll ask the questions that other folks have asked before we get into that, which is actually pretty interesting because one of the first ones that we had come through was a little bit more about the simulation kind of models and how that research works, because this person asked, it's the what if essentially, right? So if you can talk a little bit more about how that model works and how you kind of get those numbers and the results from that, I think that would be helpful.
Okay, well maybe I'll start out, and Alison, I'll pick up. We developed this model based on the Department of Education's early childhood data and combined it with their early elementary data. So we combined those two surveys, and we also combined with the Department of Labor database on adolescents. So we stitched those three surveys together, and of course the Department of Labor one goes through age 30. That's why we go through age 30. And as I mentioned, we really took very seriously the task of being true to developmental research. In other words, looking at not just economic variables, but social and emotional variables as well, and looking at various contexts of the lives of children and youth that really do matter. So I'm really delighted to have been able to do this model, and it is now done. I'm not saying that just anybody can sort of get it and run it. I'm not sure I could. It's very complex, but it is available now to do research. We finished it last December.
Yeah, it's sort of in the weeds of what this simulation we did. We have a variable for that propensity to have a birth during adolescence, and it was as simple as when we got to the adolescent stage, setting that equal to 0. So bringing that propensity down and then hitting run. It was a massive Stata file, so we changed that one line of code and let it run through the 1,000+ lines of code as it goes through every single life stage. And then at the very end, it spits out these tables that show how it impacted each of those 6 race and gender groups. And then we were able to go through and see. And so because we didn't make a change prior to adolescence, we can sort of ignore all of those things happening before age 19. Where we made our simulation, it's where you start from there and look forward to see where changes occur.
We've done other simulations on early childhood and on integrated student support model approach to education. They're available on the Child Trends website. And maybe to make it more real, I think of it as a little bit like a pinball machine. You set a process going and it ripples through all of the remaining variables subsequent in life, which is kind of like life.
Like I said, very, very fascinating. And along those lines, some of the outcomes that you presented are pretty clear, right? Like a GED or, a high school diploma. One of the ones that you kind of drew some attention to was around mental health and physical health. And I think that there are so many different ways we may, describe that or define that. So can you talk about how mental health was measured in this and the physical health was measured maybe in this outcome?
Yeah, so again, because these are coming from longitudinal data sources and secondary data, we're using how those data sets defined variables of mental health and of physical health. And so within that, like the mental health, it's a self-rating scale of ranking your mental health. And so there's a lot of math behind it. Some of the variables are standardized, and so being able to interpret that, but seeing those increases. And the health measure is similar to one that you would see in the National Survey of Children's Health or any other survey that's pretty standardized of ranking your health of poor to excellent and that like 5 ranking scale. But within the model, again, we've consolidated that into a single like score of health. And seeing how that improves, but the same measures of what we typically think of when we take a survey of evaluating physical health is the same sort of language that was used here. But If folks are really interested in this, there is a massive technical index that goes through all of the variables that are in the model and all the ways that it was created. I know when I joined the Social Genome Model project, the work was already in progress, and there were already earlier versions of this model. And so what we've really worked on the last 4 or 5 years has been refining it and building in some of those early childhood measures, as well as adding this teen birth measure to the model because it wasn't in previous versions.
I might note a couple things, one of which is that there are other simulation models, but they tend to be econometric. They're about the working of the economy, and the outcomes have dollar signs only. So to have a measure of mental health, I think, is extremely important.
I will say, in hearing y'all describe this, all I could think was, oh gosh, how long it probably took to run some of those big, like those analyses. And I'm sure you hit it and you're just were sitting at your computer for hours and hours on end, hoping no one accidentally exited out of whatever the stats platform was that you were
using. Oh yes, that was a hope that you're like, I need the power and internet to stay stable and for me to not have made a typo.
I was going to say that there wasn't anything wrong in the code, like that it didn't catch at the end. So I
yes, absolutely
fully understand that. I, had some anxiety in hearing you explain it, of just like remembering those stressful moments. So please don't let anything go wrong during this and not have to start it over.
I might note that one of the motivations for developing a simulation model like this is that, it does take a lot of computing power and all, but to do an evaluation, a random assignment evaluation, and follow the young people to see how things came out, it's rarely done more than 6, 12, 18 months. It's extremely difficult. And with this model, we can put those components of the findings into the model and take it into the future until age 30. And so that, in that sense, it's very efficient.
Oh yeah, yes, so I agree. Okay, we have some more questions coming in. One being, did research that you've done, maybe not anything that was specifically highlighted today, but any research that you've done include the impact of parent involvement? So I guess more broadly, because it's not parent involvement on a certain.
Yeah, well, we've done a lot of work on parent involvement in a variety of contexts and circumstances, and certainly that is a very important element of the life of an adolescent child. And in this particular one, it's a school program, but the students are asked to contact their parents. They can go home and talk to their parents about their goals, or they can text them from the class. They're allowed to use their phones and text the parent. So there is an explicit intention to involve the parents, because they are going to be positive resources in most cases to support their child.
And also, just in our writing of the simulation report, we looked at a number of sort of protective factors and what can contribute or what leads to disparities in teen birth outcomes, and family dynamics sometimes comes up with that. We didn't focus so much on that, just given what the simulation was, but in some of the things that are supportive of young people, and just as we think families are an important dimension of young people's lives.
Thank you. We do have a question about the website for the program, and yes, we actually do have a link for that. If you locate the handouts kind of section in your control panel, there's a resource list there, and on that resource list you will see the link. It will also be shared when we send the recording to everyone. You'll be able to access the resource link, so you'll be able to explore more and find out more there. One of the other things I think I heard you saying with the positive youth development was that it can be implemented obviously in curricula, but what are maybe some other ways organizations can implement or take a PYD approach in their work maybe outside of programming? Are there other things that they can do to kind of implement this framework in here?
Well, yeah, the main focus is, of course, how the people in the program interact with the young people, whatever age, and a lot of it's after school programs, but we're now taking it into early adulthood as well. But inevitably, that means they also interact differently across the staff. I mean, the staff people talk about what they're doing, they treat one another differently. It is an approach that has to be shared across the staff. So we've actually done an instrument called Pilot. I think you can just Google it, Pilot, P-I-L-O-T. And it's a conversation tool. And the purpose of that tool, the Pilot tool, is to get the staff to talk about how they interact with the young adults in this job training or education program, but also how they interact with one another. So it is, yeah, a system changing kind of a strategy.
But then also some of the same things that many people are already doing when they work with youth, and creating a safe and welcoming, supportive environment, having youth come up with group norms, all of those sort of day-to-day things that we don't always think of with the intention, but they carry so much value and are informed by positive youth development, belonging and supportive relationships, and creating and thinking about how you're structuring your program for youth are all elements. And also within the resource lists, we have links for a checklist for putting positive youth development characteristics into action in teen pregnancy prevention programs, as well as a resource on integrating positive youth development into PrEP programming, but it's applicable for any form of programming, not just PrEP recipients, but also that youth.gov, where Chris shared the definition and where it comes from, has a humongous repository on research and tips, as well as leaders in the field who are really doing the work and have practical tips for practitioners.
And it is worth mentioning in the DIPL organization that the secret sauce is relationships. I mean, relationships, positive, supportive relationships are absolutely crucial across settings, across age, across issue.
Thank you. I'm looking at the time and we're cutting it close to the end. So if there's, all right, there we go. We got one more question that came in right as I said that. So we'll get that one question. So I guess what motivated the two of you to do this research?
I'm sorry.
That's a great question. I'm so glad we're ending on that note.
I don't know which one. I mean, because children are the future, because we really need to take, I think, a scientific research-based approach to thinking about how we can enhance the development and well-being of children writ broadly. So this has pretty much been my life's work. Feel pretty good about it. I suspect a lot of the people on this call do similarly.
And for me, when I graduated from college, I wasn't sure what to do, but had a lot of supportive people in my life, and who introduced me to the topic of public health. But before I went and got my master's of public health, I went back and taught 8th grade math at the same middle school that I attended, and was far more interested in what was going on in the lives of my students in this rural area in North Carolina, and seeing just how health impacted how they showed up in the class and what they did. And also I had a student at 14 who was a father, and the very next class period had a female student come saying, I need to call my mom, I just got my period for the first time. And so just those range of needs within my own classroom, and having grown up in that area and not seeing significant progress in the 10 years since I had been in the classroom, the 8th grade classroom myself, was really a strong motivator in going to graduate school and focusing on adolescent sexual and reproductive health.
Thank you so much, Chris. Thank you so much, Allison, and thank you everyone for joining us on today's webinar. We do have, I think, your contact information on the next slide, and the slides and recording will be made available to everyone. So with that, I just want to draw your quick attention in our thank you for joining us today. The webinar will be available in about 3 days. So you can access that on our website. And if you could take a couple of minutes to answer the question at the end of this survey, at the end of this webinar, if you could answer the questions in the survey, that would be extremely helpful for us. It shouldn't take too long. Normally, this is where we would announce our next month's webinar, but we're taking the month off. So, either check back and watch one of our previously recorded webinars, or just take the time to do some self-care or read more about positive youth development. But thank you everyone for being here. We look forward to seeing you in August. Have a great one.
Thank you.
Thank you all.